In the hills of Sarajevo, Bosnia and Herzegovina's war dead are marked in row after row of uniform white graves. And where the markers of one war end, begin the headstones of another kind of war. Last month, this cemetery in central Sarajevo could not keep up with the pace of burials, as a steady stream of caskets arrived from hospitals that were overwhelmed with victims of COVID-19.
You couldn't see your enemy, and a lot of people are dying because of that virus. That is really a war.
Dr. Ismet Gavranka-Petanovic is caring for the casualties of that invisible enemy, a quarter century after treating the gunshot and shrapnel wounds of the Bosnian War. A bloody conflict that raged for more than 3 years, killing thousands, leaving much of the country in ruins and bitterly divided along ethnic lines. Today, Sarajevo has been largely rebuilt, but the country's ethnic divisions, invisible from above, are still entrenched down below in the system of government that requires Eastern Orthodox Serbs, Bosnian Muslims, and Catholic Croats to share power. Some observers say the complex system, designed to end the violent conflict and enshrined in the country's constitution, has made it harder for the government to end this healthcare crisis, with regional governments struggling to coordinate a response. During the war, 11,000 people died in Sarajevo alone. But in recent months, the pandemic has been taking lives at an equally shocking pace.
Because Sarajevo were completely surrounded, a lot of injury and a lot of troubles. But also in the last 3 months, in compare, that was also very similar, so difficult situation.
Best doctor, best husband, best father, best brother, best son you could imagine.
Mediha Slatina's husband was an ER physician. In November, he battled the virus from a hospital bed for 16 days before succumbing. Slatina not only lost her husband, but also her father and mother-in-law, all within the same week.
I don't know what to say. It was very hard. It was a very difficult period of my time, and we are still recovering.
Facing a record-high spike in cases in March, local governments imposed curfews and restrictions. But the fragile economy can't afford to stay closed for long. At the first sign of declining case counts, shops and cafes reopened. Some now even serve indoors. Sarajevo's mayor is frustrated by a lack of vaccines. The government seemed to pin its hopes on the COVAX initiative and surplus shots from the EU that haven't materialized.
I think that the worst possible thing is that this could be stopped as in the same way as the war could be stopped during the 90s. So I think that now we can buy vaccines. We have money to buy vaccines, but we do not have a system.
It was only January before the government began negotiating directly with vaccine producers, falling well behind the European average, just as the country records more deaths in the first few months of 2021 than in all of last year. Last month, help came from an unlikely source. Tens of thousands of Bosnians streamed across the border to Serbia after it offered foreigners the chance to take the shot for free. But it will take a lot more than just goodwill to finally stop the virus and this invisible siege on Sarajevo.